Hello, this is Dr. Stanley Lang, and welcome to this broadcast, the topic of which is on statins and memory loss, and secondarily, statins and other major side effects of the statin class. So what are statins? Well, first of all, this is a class of drugs that dramatically can lower cholesterol levels. These drugs are given to prevent heart disease and stroke primarily, although doctors in other specialties like kidney doctors and other specialists and primary care doctors give statins for a variety of different situations where they believe there is significant risk of some sort of a vascular problem. The problem is that statins cause a lot of side effects, including memory loss. I want to tell you about a patient that I was seeing today, and this patient had a very typical presentation in that her onset of memory changes was so insidious that she didn't detect that it was actually a memory problem that was happening. But she was starting to shift in a way that she just couldn't engage in life like she used to. And she's in her mid-70s. So she's far from ready to hang up life. She's still physically quite active. The reason for being on the statin in the first place is a little bit iffy, but the point is she was on this drug and had been on for some time. And the more we talked, it became apparent to me that actually a big part of what was going on was related to issues with her memory. So I told her a story of another patient of mine who loves to play golf and how he just couldn't focus on the game. And it was getting harder and harder. And the more we talked at that particular visit, it became apparent that something was interfering with his ability to concentrate. And it turned out that in his case, it was the statin drug. As soon as he stopped it, within a month, his golf game came back to a very high level of quality that he previously had enjoyed. And there is no way that patient was ever going to start a statin again because he valued being able to play and enjoy golf rather than the relatively low probability that a statin was going to help him. Now, what is the probability that a statin is going to help you? Well, it's relatively low. It's not zero, though. And if you want to go and find what the statistics are, you can look it up yourself on the Number Needed to Treat website. And it has basically two different groups of people with risk factors for heart disease and people who actually have heart disease. And people who actually have heart disease, one person is protected against a fatal heart attack out of 56 people that would take a statin drug for 5 years. That means 55 guys took this drug for 5 years with no benefit, but one person's life was saved by taking this drug. But if you look at groups of people that simply have risk factors, but they don't have actual documented heart disease, it's more like 1 in 250 that have to take the drug for 5 years to prevent one non-fatal heart attack. Now, a person who's facing memory loss or other problems that can develop from statin drugs, when faced with those statistics, in my experience, 100% of them say no thank you to the statin drug. And almost everybody that actually has documented heart disease, when they realize that the trade-off is that they have a 1 in 56 chance of preventing a fatal heart attack versus further progression of memory loss or further progression of muscle pain, whatever the side effect might be, they almost always choose against the statin drug. And that's what I call informed consent. I don't try to talk people into any kind of a conclusion. I don't care if they want to continue the statin drug, I'm happy to prescribe it, but I think they at least should know what the odds are that it's going to help them, and the odds are that it's potentially causing problems. The current estimates are that 1 in 50 will become diabetic simply by taking the statin drug. And the number that have significant muscle pain it's somewhere between 1 in 10 and 1 in 3. Now, we don't really know because doctors aren't really good at asking that question, and many patients think that they're simply developing arthritis. So one of the questions is, well, what are the alternatives to statin therapy? And there are several, and we'll touch on a couple during the remainder of this sharing here. But first of all, I want to talk briefly about coronary artery calcium scoring. Now, this is this technology that's been available for a long time. It's not utilized much in the United States. Some countries use it a great deal. And what this does is measures very accurately how much calcium there is in the coronary arteries. And you can predict whether or not a person is going to likely benefit from a statin drug by their calcium score. And if you have a very low calcium score, the probability of benefiting from a statin drug is way lower than that 1 in 250 that I was telling you about. So another way, an alternative is, first of all, to use this technology to see, well, what actually is my risk of having a heart attack anyway? And that's much more accurate than a stress test. Any of the stress tests that we have available, this is far more accurate, especially when it's done yearly. And so you see what your trend lines are. But back to the alternatives, the main thing that you can do that is an alternative to working on your cholesterol only is stress reduction and low glycemic meals. Stress reduction has been documented a lot of different ways as markedly decreasing risk for heart disease. In fact, before stenting was available, there was a great deal of initiative in the United States for stress reduction techniques to help lower the risk of heart attacks. It was well known that if you could control the stress response in people, that you could lower their risk of having heart disease. And then as soon as stenting became available, this approach to preventing heart disease just fell off the map. And I'm not going to go into all the whys, the reasons and the why and all that stuff. It just did. But it is still true. If you can decrease stress, then you can dramatically decrease your risk for heart disease. What does low glycemic eating have to do with anything? Well, it turns out that people that are in insulin resistance syndrome, metabolic syndrome, those are the folks that have the highest risk of having those high calcium scores. And the high calcium scores are what correlate more with a heart disease, a heart attack risk than any other test that we can do. So by avoiding going into insulin resistance in the first place by eating low glycemic, you decrease your risk of developing calcification of your arteries. And it's one of the major ways that you can start to reverse that whole process. So the alternatives to statin therapy include a lot of other things. You can take some herbs. There's a lot of different plant-based strategies that I don't want to go into here. But these two things are the major part of the program that we've developed and have been making available to patients for many years now, that combine multiple ways of stress reduction with a very advanced low glycemic eating plan. And you can have access to that plan if you want for 7 days without any cost, just to kind of kick the tires, look around inside, or put together your own plan that's stress reduction and low glycemic eating. But the point is, there are alternatives. Now, I can't tell you that this plan works better than a statin drug because nobody's ever done the research. But I can tell you that research that looked at the Mediterranean diet, which is one type of a low glycemic plan, showed that it was more effective than a statin drug in preventing heart disease. But they didn't go head to head, so it wasn't a double-blind study because you can't do a double-blind study on when you're eating the Mediterranean diet because you know what you're eating. A double-blind study, you don't know which group you're in. Well, you obviously know what group you're in when you're eating the Mediterranean diet. So we've never had and never will have a head-to-head study, but when you compare two populations, average folks eating the average meal, even the so-called cardiac diet versus the Mediterranean diet, and the folks doing the average approach to life are taking a statin drug, Mediterranean diet wins. That's a low glycemic meal. If you layer on that stress reduction, there's lots of evidence that shows benefit. So I can't say that there's proof because we don't have exact statistics on these things, but these things individually have been looked at for decades now. So this is not new rocket science. This is stuff that's been well established for decades, but relatively not utilized for a lot of different reasons. So one of those reasons is people don't know about it. Second of all, they're not properly motivated. They don't think that they can do it. In my experience, patients, once they know what they can do and how easy it is to do, they do it in relatively high numbers. Not everybody does, but a lot of people will when they're properly motivated. And you might be one of those folks. You might be properly motivated to make the lifestyle changes that will dramatically lower your risk for heart disease. And so if you're interested in that, being one of those folks, then click on the link and take a look at that program. Otherwise, I encourage you to at least get a coronary artery calcium scan and see what your risk is, and use that as an annual tool to see how you're doing. So I wish you well, and if you're having trouble with your memory and you're on a statin drug, you should at least attempt to connect the dots. There's probably a relationship between your memory loss and the statin. I wish you well, God bless, and have a great day.